Female reproduction. Oogenesis. Oogenia 2N undergoes mitosis. 2N primary oocyte. Meiosis 1 arrested puberty in the closing stage of prophase. Meiosis 1 at puberty, single N, and first polar body, secondary oocyte. Meiosis 2 arrest in metaphase. Meiosis 2 resumes during fertilization, second polar body, female pronucleus. Regulation. Hypothalamo-pituitary ovarian axis. Two-cell gonadotropin model. Hypothalamic pituitary ovarian axis. Hypothalamus releases gonadotropin releasing hormone, goes to positive effect on anterior pituitary, which releases luteinizing hormone and follicle stimulating hormone. Luteinizing hormone works on theca cell and produces androstenedione, which converts into androstenedione, which converts into estradiol. Follicle stimulating hormone works on granulosa cell, which produces androstenedione, progesterone, activin, and inhibin B. Inhibin B and activin have negative reflex on follicle stimulating hormone on anterior pituitary, and progesterone has negative effect as well as estradiol has negative effect on luteinizing hormone on anterior pituitary. Menstrual cycle. 28-day cycles in females. Note, estrous cycle seen in mammals other than human. Changes in ovary. Follicular phase. Follicle stimulating hormone causes follicular growth. 10 to 15 follicles grow. One follicle becomes dominant, Graafian follicle. Maximum follicular stimulating hormone receptors, maximum aromatase activity, maximum estrogen production. They produce estrogen, which increases LH. LH surge, positive feedback. Then LH surge exon primary oocyte, meiosis 1 is completed. Ovulation, progesterone synthesis, synthesis of prostaglandins. Here we have LH levels and time. LH surge, LH peak 10 to 10 hours before ovulation, 24 to 36 hours before ovulation. FSH surge, lysis of follicular wall on 14th day, causes ovulation. Corpus luteum, luteal cells bleeds. Luteal phase, bleeding inside Graafian follicle, causes clots. LH, luteal cells, yellow colored. Corpus luteum, if fertilization does not occur, degenerates on 24-day cycle. Menstrual blood loss. Corpus luteum also secretes progesterone. Changes in endometrium. Endometrial changes. Phases: constriction of spiral arteries, ischemia, degeneration, shedding of superficial two-thirds of endometrium. Menstrual day phases 5 days, influence of PGF2 alpha, influence of estrogen proliferative phase, 1 week to 2 weeks, increase endometrial thickness, increase size of glands without secretion, ovulation, secretory phase, 15 days to 28 days, influence of progesterone, spiraling of blood vessels, maximum endometrial thickness, uterine gland secretes clear fluids. Changes in cervix. Cervical mucus under influence of estrogen and progesterone. On influence of estrogen, it is thin, watery for easy sperm movement. Spin bucket effect, stretchable elasticity, increase NaCl and decrease port protein, causes fawn pattern on microscopy. Progesterone thick and less elastic pattern. Changes in vagina. Vagina parabasal cell, superficial cell, intermediate cell. Parabasal cell, lack of hormonal activity. Lack of hormonal activity, parabasal cells, superficial cells dominant under estrogen influence, intermediate cell dominant under progesterone influence. Basal body temperature increases by zero point 0.5 to 1 degree Celsius during ovulation due to progesterone thermogenic action. Female sex hormones, steroid hormone, and protein hormone. Steroid hormones are estrogen and progesterone. Protein hormones are inhibin, activin, and relaxin. Steroid hormone, estrogen, is 18 carbon steroid. Sources is granulosa cell, placenta, corpus luteum, which forms estradiol, and estrone. Estradiol is seen in reproductive age group in circulation. Estriol is seen in pregnancy and estrone in menopause. 60% is bound by albumin. Unbound percentage is 2%, which produces effect. And gonadal steroid binding hormone, globulin, GBG, gonadal steroid binding globulin, sex hormone binding globulin, SHBG, is 38%. Actions: uterus, estrogen. Uterus is estrogen dominant. Uterus, it causes increased blood flow, more active, increased contractibility and excitability. Secondary sexual characteristics such as female body contour, fat distribution in breast and buttocks, growth promotion, ductal proliferation. Bones produce osteoprogesterone inhibitor of rank ligand. Inhibitor of rank ligand, decrease osteoclast differentiation, inhibition of bone resorption. Liver, decrease plasma LDL cholesterol, serious, inhibits platelet activation, promotes vasodilation by increased nitric oxide. CNS, neuroprotective, inhibit neuronal cell death. Kidney salt and water retention. Progesterone acting. Anti-estrogenic action, less active on the uterus, less excitable, less contractile. Breast promotes alveolar growth. PNS thermogenic action increases basal body temperature by half to 1 degree Celsius during ovulation. Respiration stimulates respiration. Carbon dioxide washout, decrease alveolar partial carbon dioxide levels, kidneys, natriuresis, salt and water expression. Only steroid hormone to cause natriuresis is progesterone. Only steroid hormone to cause natriuresis is progesterone. Protein hormone inhibin. Sources corpus luteum inhibin A, granulosa cell, inhibin B, action, negative feedback inhibition of follicular stimulating hormone, relaxin sources uterus placenta, activin stimulates follicle stimulating hormone, polystatin inhibits follicular stimulating hormone, relaxin actions, relaxes pubis symphysis and dilates cervix, aids in labor. Human chorionic gonadotropin, HCG, glycoprotein hormone, sources syncytiotropoblast, units alpha subunit, beta subunit, similar to follicle stimulating hormone, luteinizing hormone, thyroid stimulating hormone, beta subunit similar to luteinizing hormone. T half of HCG is 37 hours, while LH is only 30 minutes. Potency of HCG is 80x compared to LH. It's released from syncytiotropoblast. Functions maintenance of corpus luteum up to 6 weeks of pregnancy. Leydig cells testosterone. It causes Leydig cells to secrete testosterone, immunosuppressive activity, no fetal rejection. Corpus luteum asks them to release relaxin. Lactation processes seen, mammogenesis, lactogenesis, galactokinesis, galactopoiesis. Mammogenesis, growth of breast. Estrogen causes ductal growth and progesterone causes lobulo-alveolar growth. Lactogenesis, production of milk. Prolactin, insulin, growth hormone helps in lactogenesis. Galactokinesis, release of milk. Milk ejection, letdown reflex, suckling, stimulates hypothalamus, oxytocin released from posterior pituitary, neuroendocrine reflex inhibited by anxiety, pain, and depression. Galactopoiesis, maintenance of lactation caused by prolactin.